Hi, I'm Dr. Wendy Wagner, lifetime OBGYN, and this week I'd like to go over the 12-week OB visit. Generally, the 12-week OB visit includes an ultrasound as well as some sometimes confusing options for testing for genetic diseases. So we're going to go over the options for testing and we'll take it from there. So there's a number of options for testing at 12 weeks of pregnancy for different genetic issues. It can be confusing because of what's being tested for and the options for testing. Be clear about what we're testing for. We're not testing for many different diseases. We're not testing for infrequently found diseases. We're testing specifically for, or we're offering testing specifically for trisomy 21, which is Down syndrome, and trisomy 18. Now, why just these diseases? These diseases are tested for a couple of reasons. One is they are two of the most common genetic issues, genetic syndromes that are present, and two is they're easier to test for. Trisomy 21, which is Down syndrome, many people are aware of this. It can span the spectrum of many health problems and considerable intellectual incapacity to a more mild form, but that's trisomy 21. Trisomy 18, an extra 18 chromosome, number 18 chromosome, is usually incompatible with life. Most babies either die in utero or within 2 weeks after delivery, very infrequently live to 1 year. So there are three different options for testing. One that a lot of people don't think of is none, no testing. Some people, if they think about it, if we said, listen, if you were to have a baby that's affected with Down syndrome, would you make a different decision? Would you want to know? And I do have some patients that say, no, I don't want any testing. We'll do the ultrasound to make sure that there's not any major abnormalities, but none. And that's certainly something that you can opt for. The second one is called sequential testing. The first part of the sequential testing is done at the 12-week visit. It can be done 11 to 14 weeks. And very simply what this is an ultrasound looking at the nuchal translucency of the baby. And so we will look at a picture of what the nuchal translucency is the measurement of the skin thickness on the back of the baby's neck when the baby's in a profile view, along with some other measurements that are done during the 12-week ultrasound, including the crown rump length, which is the size of the baby, looking at some different anatomical things. The nuchal translucency is really important for that. So that is certainly part of the sequential screening. The other parts of the sequential screening are two blood tests, beta HCG and Pate. The way these blood tests are taken is by a finger stick blood test, and just like a diabetic would do, stick your finger and put some blood on a card. Your age is also taken into account, and that will give you a risk. So it doesn't give you a positive or negative. They won't say your baby has Down syndrome or your baby doesn't have Down syndrome. It will give you a risk. That's part of what's difficult to understand about the sequential testing. It will give you a risk that's, say, 1 in 300. And the way I like to look at this is if you were standing in a room with 300 people and they all had the same test results as you, only one person would have a baby with Down syndrome. So, not too bad. If you get a test of 1 in 50, that's a little more risky. 50 people standing in a room, one of them would have a baby with Down syndrome. Now, a lot of people ask why the age of 35 is the quote-unquote magical age for the risk of Down syndrome increasing. And there's nothing magic about 35. What happened is, many years ago, when people 35 and older used to routinely get amniocentesis, the risk of losing a baby or having a major problem with amniocentesis was the same as the risk of Down syndrome at the age of 35. So that was the point when it made sense to offer people an amniocentesis. And that risk was 1 in 270. Okay? Now we don't do amniocentesis much anymore, and I'll talk to you more about that, but that's what 35 is about. So if you choose to get the sequential one, you will get a risk stratification. You'll get something like this, and I'll show you what the report looks like. Okay, so these are the blood tests. This is the nuchal fold measurement. You can see the age, the weight, all this stuff is in here. So the results of this, what you'll get is, like I talked about, this person is actually 34, so her age-related risk, which means if there was no testing done, we'd tell her risk is 1 in 270 of Down syndrome and 1 in 970 of trisomy 18. The risk cutoff, which means the risk at which we will call you and say you have an increased risk, is 1 in 50. The important part is the screening risk. So based on this particular woman's blood work, age, and nuchal translucency measurement, she has a Down syndrome risk of 1 in 1,900. So it's not positive or negative, it just means if 1,900 people were in a room with these results, only one would have a baby with Down syndrome. Trisomy 18 risk is much better, 1 in 10,000. So normally we would call a patient like this and tell her you have a low risk sequential screen. Okay, and then after this, there's a decision to be made which test to do as follow-up. So the classic follow-up to the sequential 1 is the sequential 2. At that point, it's just blood work. Basically, it's these 3 blood tests, which will give more of a reassurance of a decreased risk of Down syndrome, and then what we call AFP. AFP is a blood test that, if increased, will say that will give a clue that there's increased risk of neural tube defect, spina bifida, things like that, that you could follow up with ultrasound. So if you choose to do the sequential 1 and the sequential 2, at the end of the sequential 2, you'll get a report very much like this, telling what your risk of the trisomies are. Okay? Now, the other option for testing used to be available just to women who were at high risk. So in other words, over 35, increased risk of Down syndrome, that kind of thing. It's a very different test, and it's called cell-free DNA. There's a number of different brand names or lab names for the cell-free DNA, but it's all done the same way. Basically, the way it's done, which is very interesting, is that blood work is done, so all of these tests are non-invasive. It can be done as early as 10 weeks, and in the mom's blood, the baby's DNA is found. So they are actually looking at the baby's DNA. Because they're looking at it, they can tell 99% whether the baby is affected with a trisomy. So if there's an extra chromosome. So all chromosomes look like this. They have 2 copies. If there's an extra one, they can see it. The other benefit of the cell-free DNA is that you can also tell whether there's an extra sex chromosome. So women are XX, men are XY. There are a number of different syndromes where there is an extra chromosome here, and that can be seen.